When more doesn't always mean better, imagine this. You've spent your whole life believing that routine medical checkups are the golden ticket to staying safe. You grew up hearing that prevention is the best cure, that the more tests you take, the more protected you are. But what if I told you that after age 70, some of those very same routine tests can actually do you more harm than good? I know that may sound strange, Evan, a little unsettling, but it's the truth. Many seniors never hear, not every screening is harmless. Not every exam automatically adds years to your life. In fact, sometimes they quietly steal your health, your peace of mind, or even your independence. And here's the thing. Doctors aren't villains. They're simply following guidelines, training, and habits developed decades ago. But medicine evolves. And just as our bodies change with age, our approach to health must change too. So today, we're going to talk honestly about 5 common medical checkups that after 70 might be riskier than you think. I'll share the science, the hidden dangers, real-life stories of seniors just like you, and most importantly, safer alternatives and practical wisdom you can use right away. This isn't about fear, it's about knowledge. It's about protecting not only your years, but the quality of those years. Part 1. The colonoscopy trap for decades. Colonoscopy has been hailed as the gold standard for preventing colon cancer.
Doctors recommended
It almost automatically for adults once they hit their 50s and 60s, and make no mistake in middle age, colonoscopies can save lives, but here's what most seniors don't know. After age 70, especially if you're healthy and symptom-free, colonoscopies can do more harm than good. The hidden risks, sedation, sensitivity, as we age our brains become more vulnerable to sedatives and anesthesia. Seniors are at higher risk of confusion, dizziness, and even long-term memory fog after the procedure. Bowel prep danger. Drinking gallons of harsh laxatives to clean out your system sounds unpleasant at any age, but for seniors it can. Triggered dangerous dehydration, electrolyte imbalances, and even kidney problems. Overtreatment of harmless polyps. Many small polyps take 9 to 15 years to develop into something dangerous. But in your 70s or 80s, aggressively removing them may offer little benefit while exposing you to biopsies, repeat scopes, and even surgery. A story that says it all. George, an 82-year-old retired engineer, was convinced by his doctor to have a routine colonoscopy, even though he had no digestive symptoms. During the prep, he became dehydrated. After the procedure, he was dizzy. From sedation, that night he fell at home and broke his hip. Months of rehab followed, and the kicker, the scope found nothing. George's story isn't rare. It's a quiet reminder that sometimes prevention turns into punishment. The better option? If you've had clear colonoscopies before and you're symptom-free after 70, consider less invasive alternatives. Modern stool tests like fit fecal immunochemical test or Cologuard are safer, easier, and often just as effective at catching what really matters. Remember, declining a colonoscopy doesn't mean ignoring your health. It means respecting your body's limits and choosing wisely. Part 2. The full-body scan illusion. We live in a world obsessed with technology, and the idea of a full-body scan, an MRI, or a CT that looks from head to toe, sounds tempting. Who wouldn't want to catch hidden problems before they strike? But here's the harsh truth. For seniors, full-body scans often create more problems than they solve. The trap of overdiagnosis. These machines see everything. Tiny nodules, harmless shadows, little spots that may never affect your health or lifespan. But once doctors see them, the chase begins. More scans, biopsies, surgeries, all 4 things that may never have mattered. The emotional toll. Instead of living fully, many seniors end up consumed by what-ifs. One tiny shadow on a kidney scan becomes a mental time bomb. Anxiety skyrockets, and quality of life plummets. Betty's story. Betty, a vibrant 78-year-old, went for a discounted body scan at a health fair. They found a tiny lesion on her kidney. It wasn't dangerous, but fear took over. Within weeks she had surgery. The recovery drained her strength, her energy, and her joy. She often says she wishes she'd never stepped into that scanner. The hidden cost. Insurance rarely covers full body scans. Seniors often pay out of pocket, thinking they're buying peace of mind. In reality, they're buying a ticket into a never-ending medical maze. The wiser choice. Unless there's a strong medical reason, skip the full body scan. Instead, focus on listening to your own body real symptoms. Tell the story better than any machine. Trust your energy levels, your comfort, your everyday experience. Part 3. The stress test spiral. Few things are scarier than heart disease, and the treadmill stress test, hooking you up to monitors while you walk or run, has long been seen as a reliable way to check heart health. But after 70, stress tests often backfire. Why? False positives. Aging naturally changes your heart's electrical patterns. The test can mistake normal aging for disease. The cascade effect. One questionable result leads to angiograms, catheterizations, and stents procedures that carry serious risks for seniors, complications, bleeding, kidney damage, infections, and once you're on blood thinners after stents, new risks like internal bleeding appear. George No. 2's story. George, a 74-year-old bus driver, had a stress test even though he had no symptoms. The test looked suspicious. 3 weeks later, he had an angioplasty. Soon after, he developed a severe infection. 6 months in and out of hospitals followed. His health never fully recovered. The smarter way. If you're not having chest pain, shortness of breath, or unexplained fatigue, most cardiologists now say, skip the stress test. Instead, focus on proven heart health basics. Walk daily, eat a heart-healthy diet. Manage blood pressure and cholesterol with lifestyle and simple meds if needed. Stay socially connected and manage stress. These do more for your heart than any treadmill machine ever could. Part 4. The repeat colonoscopy mistake. Many seniors believe if one colonoscopy was good, then repeating it must be better. Repeating colonoscopies into your late 70s and 80s often brings more danger than protection. The biggest issue? Sedation. Risks increase with age. Preparation becomes harder and more dangerous. The benefit window shrinks. Polyps take 10 to 15 years to become cancerous. If you've had clear results, repeating late in life offers little gain. Eileen's story. Eileen, a 78-year-old retired teacher, had to clear colonoscopies before, but her doctor recommended one more to be safe. During the procedure, her colon was perforated. Emergency surgery followed. She survived, but her independence was gone. She spent months recovering and never regained her former vitality. Lesson: if you're over 70, healthy, and had recent clear tests, routine repeat colonoscopies may not be worth the risk. Instead, monitor real symptoms: blood and stool, persistent pain, unexplained weight loss. Those are signals that deserve attention. Part 5. The heart test obsession. Heart disease fear is powerful. Doctors often recommend stress tests or imaging just in case. But for seniors without symptoms, this often leads to overdiagnosis, overtreatment, the loss of quality of life. Harold's story. Harold, 76, had no chest pain. He walked daily, played with his grandkids, and felt fine. But during a checkup, his doctor recommended a stress test. It led to a stent procedure. Complications from blood thinners sent him to the hospital with internal bleeding. 3 months of recovery followed for a problem that never needed fixing. The takeaway? Aggressive testing isn't always the wise choice. Symptom-based care, paying attention to real signals your body gives, is far safer after 70. The hidden costs? Beyond the procedure, what often gets overlooked are the non-medical costs of unnecessary tests. Emotional, anxiety, fear, worry, physical, recovery time, weakness, complications, financial, out-of-pocket bills, uncovered scans, medications, loss of independence, falls, surgery side effects, reduced mobility. After 70, life isn't about chasing every possible disease. It's about living fully with dignity, energy, and joy. What you can do instead. So what's the alternative? Here are safer, smarter strategies. Lifestyle first, daily movement balanced. diet, sleep, and stress management, symptom-based care. Only test when there are real warning signs. Better conversations with doctors. Ask, will this test actually change my treatment or my outcome? If not, maybe it isn't worth it. Trust. Your body, your energy, comfort, and independence matter more than any machine result. Stories of wisdom. Some of the wisest seniors I've met are the ones who said no to unnecessary testing. They chose fewer procedures and more living, and they're thriving, walking with friends, enjoying family, laughing, traveling, and savoring the time they have. Conclusion: health after 70 is about quality, not quantity. Being older does not mean being powerless. In fact, it's the age of wisdom, when you've earned the right to choose what matters most. Saying no to some tests is not neglect. It's wisdom. It's protecting your dignity, your independence, and your joy. So if you're over 70, here's the truth. Colonoscopies, full body scans, and routine stress tests may not always serve you. Listen to your body, ask better questions, and focus on what truly improves your life. Because healthcare after 70 should not be about endless procedures. It should be about your values, your comfort, your happiness. And if this message resonates with you, here's what I ask. Subscribe to our channel. Turn on the notification bell. Share this with someone you love. Together, we can change the conversation around senior health from fear and over-testing to wisdom, dignity, and life well lived.